Hello, everyone. It's Alicia Hurt here, your servant leader. I am here live from the Women's Wellness Center in Bainbridge, Georgia. And today we are talking all things birth. We are doing another class in our series to support the birthing process. So, as I always ask, please share this video so that way those in your community that need the information will receive it, because you never know who needs this information. I am fixing the privacy on it now, so it is public. Please go ahead and share it. We're going to get started. I'm going to give you this information so that you can enjoy the rest of your day. All right, let me share it in a couple places. Let me go ahead and share it. Again, I'm Alicia Hurd, the Executive Director and Founder for I See My Baby Women's Wellness Center here in Bainbridge, Georgia. We're located at 310 South Scott Street. Our phone number is 229-939-3240. And we are here Monday through Friday to support you with all of your wellness needs. We provide yoni steaming classes, yoga, African dance classes once a month, and also support system classes. We have a team of doulas, mental health practitioners, and support members. So for all those that are expecting a baby, I want to say congratulations. And why haven't you called me? We are here to support you. We have doulas ready to take on additional members of the community and become your advocate. You know, childbirth is one of the most profound experiences that you will have. And so a key to that is being prepared so that you feel confident and empowered. And so this class is here to help you deepen your understanding of labor, medical protocols, and the post-birth care for both the mother and the baby. We've had one other class to date, and if you missed that class, you can either catch it on our page or you can go to our YouTube channel and go under our classes and webinars to see that class. So today, again, we're talking about the labor, we're talking about your medical team and the hospital protocols, effective pushing techniques, we'll go over that, and some delivery expectations, what happens after birth, talking about that placenta delivery and newborn care, and the critical 24 hours after birth as you're adjusting for both you and the baby, and real life birth stories. We'll talk briefly about those things and how we're able to support you in your birthing journey. So let's understand the stages of labor. So you may say, okay, I'm a first timer. What is labor? Well, it is the process that your body goes through to say, baby is coming, it is coming, it is time. And as you can see in those pictures, all those things depict the different phases of labor and how your hormones are changing, how your cervix is dilating, and how you're feeling those uterine contractions. So the first phase, you're about 0 to 4 centimeters dilated, and a medical professional will be the one to check you, not your doula. It'll be your medical professional. And that can last for several hours to days. It really just depends on mom and baby, how you progress. And there are some signs to look for. You may have mild or irregular contractions. They will feel similar to minor period cramps. You may even lose your mucus plug during that process. And you may say, well, I don't know what those things are. And that is why you have your medical team, so that way we can coach you along the process. Now, during that 0 to 4 centimeters, that's typically when you're at home, unless the contractions are really becoming regular and more close together, and you'll have to time them as well. You want to stay hydrated during this time, and if you can rest, just rest. So because your body's going to do it. This is what you were made to do. This is what's happening. Now, your support person during this time, they want to time those contractions to support you and track them, because that will tell your medical team if you need to come in to the hospital, to the birthing center, or if your midwife needs to go ahead and come onto your house for the home birth. Now, during that second phase, it is the active labor phase, And during that time, you're in 4 to 7 centimeters dilated. Again, your medical professional will check you and be able to determine where you are in that process. Now, this normally lasts roughly 4 to 8 hours on average. But again, it can vary depending on you as the individual. Is this your first pregnancy, second, third, fourth? How are your muscles moving? How are you progressing? And you usually have stronger contractions and they last between 30 and 60 seconds. So as your partner, as they're timing it or as you're timing it, if you see it's between that 30 and 60 seconds, then chances are you are in active labor and they're coming more regularly. And then it will progress to 3 to 5 minutes as well, more regularly. You'll have back pain or you may have pressure as the baby is now moving down. Now, you really need to call your provider and head to your birthing location. So whether that's a hospital, whether that's a birthing center, or call your midwife and say, girl, come on over, it's time. You want to use your labor positions like squatting and leaning forward, and also practice your focused breathing. And we'll get into those breathing techniques a little later on in this presentation. And also apply comfort measures like the warmth rag or massage or putting on your aromatherapy. Your support person, your partner, family member, or your doula. They'll encourage you to stay hydrated between contractions. They'll help you with your breathing. They'll also offer you a steady hand for support. They'll help you with counter pressure on the lower back, and they'll also keep the environment calm. If you need soft lighting, music, affirmations, all of the things that we would have discussed during your birthing plan. Now, in that third phase, you will be about 7 to 10 centimeters. There's no turning back. And so this is the shortest amount of time, but it is very intense. It may be between 30 minutes to 2 hours. Very, very intense. You'll have intense contractions. You'll feel pressure. You'll have the urge to push, like you want to have a bowel movement or something. You'll just want to push. And with this, you'll probably be shaking. You'll be nauseous. You'll have hot flashes. You'll probably say all kind of things like I did. I don't want to do this no more. I can't. But you have a team there to keep you calm, to reassure you, to give you physical support, to help you to breathe along as you're doing those final, moments where you're getting into the next phase, which is phase 4. And in that phase 4, you're pushing and you're delivering that baby. And it can last between 20 minutes to 2 hours or even more. It really depends on the factors like your baby's positioning, if this is your first delivery, and the pressure, it continues to be intense, and you'll start to feeling the need, like I said, to have a bowel movement, like you just want to push because there's pressure on your rectum. You'll have contractions. They may space out slightly, but because it gives you a chance to rest in between your pushes. You're also going to work alongside your medical team. They're going to give you guidance. They're going to help you to continue to push. They're going to tell you when to pause and when to keep pushing during the contractions. And then you'll use the best pushing position for you. So it may be just laying on your side. It may be laying on your back, your hands, maybe on your hands and your knees, maybe squatting. And you need to listen to your body. So if you feel the urge to push, follow what your body says. Again, I have told you time and time again, I am not a licensed medical professional. I am a certified doula. If you want to confirm or be reassured about anything that I am saying, please contact your medical professional, which is your OB or your midwife. Now, during this final phase, which the pushing and the delivery, your partner, your doula, we're providing you with such encouraging words like you're doing great, you're almost there. If you desire to maybe feel the baby's head, that may motivate you to keep pushing, to keep moving forward, to see your progress. You can even ask them for a mirror so that way you can see where you are, how far along you are as you continue to push and bring that baby into the world. We help you with the physical support, again, by holding your leg and supporting you, maybe to be upright. And we're there, we're present, and we're celebrating you along the way. So medical team protocols and what to expect. So they're going to monitor you. They're going to have interventions throughout the entire process. They continuously monitor the baby, which is called the fetal vitals, to make sure the baby is not in distress, make sure everything is copacetic and how you are progressing in the labor. They also have common pain relief options, such as an epidural, which it provides effective pain relief, but it limits your mobility. So when you have an epidural, you will not be able to squat or do a whole lot of movements because it's going through your spine and your back. And so you can't move a lot. My first 2 pregnancies, I had epidural and it did not work because it came out because sis was moving around and carrying on, and yeah, epidural didn't stay. And so I literally pushed those babies out without the epidural. Also, IV medication straight through your arm, and it offers you moderate pain relief with some sedation. So it's not as effective as the epidural, but it can help to relieve some of your pain. And then those natural techniques, which I love, the breathing exercises, because remember, your mind is so powerful that it can help you if you really zone in, you meditate, you breathe. It can help you to get through those contractions. Counter pressure, also hydrotherapy and medication are other techniques. And some of them, it really depends on your preference, but we talk through those during your birthing plan as well when you consult with us as doulas. Then they have other medical interventions, such as artificially breaking your water, which helps to speed up the labor. It is uncomfortable, but it is a way to get labor going. Pitocin as well is used for induction. I've used that for, I want to say, 2 of my babies. Yeah, I think 2. Yep. To get the process going. Of course, a cesarean, and that is if you've had a complication or if you know that you're not going to naturally push, then you are pre-scheduled for that C-section. Advocacy and education. And so as your doula, we definitely support you and advocate for you the whole step. From the beginning all the way to labor, and we help you understand what the doctor is saying, the medical terms they're using, what does that mean, and you know, things to consider when they tell you what intervention or pain relief options that they're suggesting. Knowing your birth plan again, discussing it with your care team, which is your support person and also your doula, and advocating for your personal preferences. It helps to ensure a positive birth experience. So yes, the medical professional is certified, but if you wanted to say, oh, let's give it some time, maybe let me walk around, maybe let me do some exercising before you artificially break my water, you can do that. You can advocate and communicate that is what you would like. And they have no other alternative but to support you in that, unless there's some medical risk, then they have to tell you. And then we cross that bridge when we get there. So the pushing process and birth. So how do you push effectively? Yes, there's a method to pushing. So you're aligning with the contractions, and that helps you to optimize each push. Meaning, if you push during a contraction, you can progress the baby moving down, because the contraction is telling you the baby is moving, and you pushing, it will help you through that process. Also, various pushing positions can help you, like squatting, laying to your side, being on all fours, upright positions. They really help you in pushing and progressing your labor process. Also, guiding great breathing techniques help as well. Focused breathing, it enhances your oxygen for both the baby and mom, and it helps to conserve your energy. So that's why you need to learn the breathing techniques. And there are a lot of ways to learn that. You can go to a Lamaze class. I did that with my first baby. We also support you in that as a doula. We help you through the breathing process. If you are somewhere in virtual land, you can go to YouTube. YouTube can help you with that as well. There are a whole lot of resources to support you in practicing your breathing techniques so that you learn it. You may not remember the different names, but you know, oh, this is the, like, you know what you need to do. Also understanding your fetal positioning, head down. What does that mean? Facing the spine. What does that mean? Because it leads to a smoother delivery. And if the baby is positioned differently, then of course your medical professional there will assist you in repositioning techniques, and as the baby's coming out, to turn or to tell you to push in a certain way to help the baby come out more safely, and so that it's not traumatic. So delivering the baby and immediate postpartum. So what to expect? So the baby's head, of course, it crowns first. And so remember, I was saying maybe to help you in understanding how you're progressing, maybe you want to put your hand there to touch the baby's head, or maybe you want them to give you a mirror so you can see your baby crowning. That will help to motivate you. I'm doing this. Let's go. I want to see my baby. Let's get that baby out. Also, medical professionals, they may use their hands on you to guide the process, you know, they may go around the baby's head to kind of stretch a little bit to help baby come on out. Right after the baby is born, you don't have to have the cord clamped immediately. You can request delayed cord clamping. You can say, hey, nurse, hey, doctor, my desire is not to have the cord clamped immediately. I would like for it to change color and look white in order for you to then clamp, because it helps provide additional oxygen and nutrients to the baby. Also, skin to skin. When my baby comes out, all is well, please place my baby on me, because I want to do skin to skin. It promotes bonding, it stabilizes your baby's temperature, and it initiates the breastfeeding process. Your body will kick into gear naturally and say, "Ooh, time to give some milk. The baby is here." Also, the newborn assessments, they automatically do that. It's called an APGAR score. And you want to look that up, and it'll give you a checklist of everything that they're looking for in order for your baby to pass that assessment. The responsiveness of your baby, the breathing, the heart rate are some of the things that go into the assessment that they do after the baby is born. All right, so let's dive a little deeper into this placenta role and delivery time. So the placenta, it typically delivers within 5 to 30 minutes post-birth. And say if you've had a small tear or what have you, you probably don't even know that it's being delivered, because you're like, oh, I just got finished. Oh, I'm just like, and the placenta is coming on out too. And it's mild contractions when it's coming out. It helps to facilitate it coming out of you, the expulsion of it. And so here's some of your options for it. You can have it capsulated, which means you place it on ice. You let the nurse and the doctor know, hey, I'm taking my placenta with me. They'll put it on ice for you. And then we do provide that service here at the Women's Wellness Center, where it can be capsulated. We will convert the placenta into capsules for your hormone balance and your postpartum recovery, and you can take those. And if you want to, are you interested in it, you can definitely give us a call and set up a consultation, and Miss Tiffany would definitely love to speak to you about it. She's just so excited about this. Also, if there's an unfortunate, if there's a, what is it going to say? I'm sorry. If you wanted to bury it, or if you wanted to have a ceremony with your placenta, because some cultures, they honor the placenta through traditional rituals, we can support you in that as well. If you wanted to save it for stem cell storage, there are companies, and if you reach out to us, we can give you that information that will do that for you, and they will have your umbilical cord as well in a blood bank, and it can be used for medical use if it ever needed in the future. So please do your research and due diligence. And if you have any further questions on that, please reach out to us. We can support you. Now, newborn care, the first 24 hours. So delayed versus immediate bathing. It is completely up to you. It is your preference. You can advocate for your baby. Also, the vitamin K shot, it helps with preventing clotting and disorders. The eye ointment that they give, the hepatitis B vaccine, all of that you can advocate for. It is your preference. You can speak up on it, what's best for your baby. Also, feeding and support, you do get some of that in the hospital, but if you want more personalized care and support, having a doula makes the world of a difference, because we're there with you throughout the whole time to help you with the latching process, positioning, and initiating the breastfeeding process and lactation support. And when you get home as well, we also visit you and support you with that. So mom, your first 24 hours to 48 hours post-birth. So of course, your vaginal birth recovery, you will be bleeding. You will have some contractions, in the hospital, they will kind of push on you to kind of help your womb and things to get back to where it's supposed to be. And then we always recommend, after your 6 weeks is up and you're cleared by your medical professional, to have a yoni steam so they can continue to clear out all of the after birth that has not come out, and to help with your hormones to make them imbalance, to correct them. Because that contributes to having postpartum depression. And it's similar for the C-section, but of course you're healing that incision area as well, making sure it doesn't get wet and saturated after your shower, making sure your stitches are healing like it's supposed to. With my third baby, I actually popped the stitch and I had to go back in, and she's 5, going to be 6 soon. And I sometimes can still feel that area where my stitch popped. It's just crazy to say, but like when the weather is different, like I can still ache in that area. So you want to make sure you do not pop your incisions and that you heal correctly. Also, the emotional well-being. You may have baby blues versus, postpartum depression. And it's normal to experience those mood changes, but you have to know the difference. And having a doula, having a postpartum doula and support person really can help to identify those things and get you the support that you need. Also, you make sure that you're hydrated, that you're eating, and that you're resting. And I know you're like, Alicia, that's a whole lot when we were trying to take care of a whole little human, but you can do it, especially with the additional support that we can have and provide to you. So here are some case studies for you, some real birth stories. Give me one moment. All right, so case study number 1, natural birth with doula support. So the situation is a first-time mom desiring an unmedicated birth. So the doula will provide continuous encouragement, breathing guidance that is super important, and also the positioning assistance. So that way mom can get through the unmedicated birth. We help with the emotional and the physical support, again, throughout the labor, and the support systems, they significantly impact birth satisfaction. So case study 2, it's a medical induction with epidural. So this is a second-time mom needing an induction due to high blood pressure. And the medical team is monitoring her vitals, managing her epidural, meaning the epidural is in your spine, but you get continuous medicine. And so there's a flow that they give you to make sure you don't feel anything, that you're comfortable, that you have the right amount throughout the C-section. Or throughout the induction, I should say, in the process. Also, they're adjusting the Pitocin levels, which is to help the labor to progress. How can a doula help? Well, we can assist with relaxation, because the doctors and medical teams are making sure that your pressure is good, baby fetal heart rate is good, but you need someone alongside you, making you feel relaxed, helping you along the way, communicating, and they're reassuring you emotionally, and they're helping you with the best positions possible. Because remember, when you have an epidural, you are limited to the movements that you can make. Also, the takeaways is that we give you all the information that you need so that you can make an informed decision and have a positive experience. So the third one is an emergency C-section. And in this, the baby has shown signs of distress. And distress means the heart rate may be declining. It may be too fast. It's just not showing that the baby is responding to labor as they should. And so the medical team will quickly assess it and say, all right, it is time to do a C-section. This is our process. As the doula's there, they're going to provide you with the education to communicate what the doctor is saying, why they're saying it, what is your comfortability, and then also pre-surgery, your emotional reassurance and postpartum support. And I've heard of situations where if the mom calms down a bit and gets pushing and really sinks herself in, then the baby starts to respond well and they'd avoid a C-section. And some stories where no, mom is really in distress, baby's really in distress, and C-section was the route to go. It just really depends on your situation, but having a doula and support person there, it helps to turn things around emotionally, and it helps for a positive outcome during your labor process. Because the key is to have a safe baby come out healthy. So again, why choose our birth support services? One reason is that we have personalized birth education, which is tailored to guidance for all birth preferences. Another is that we have experienced doulas and birth coaches on our team, and we provide those emotional, physical, and informational support ongoing throughout your process up until birth and during. We also have postpartum and lactation support. We ensure a smooth transition into motherhood, and we communicate with you throughout the way. Also, we have community and sisterhood, and we have a network here that supports you to help you understand that you are not alone navigating your journey to motherhood. So what I would say to you is to schedule your time with me, schedule your time with Tiffany, schedule time with us, and ask all the questions that your heart's desire, because we know that every birth is unique. Every mom has different outcomes that she desires. Also, we want you to feel confident in your decisions. We want you to understand your options that you have available. And we want you to be here with us and to experience another phenomenal birth with us here at I See My Baby. We are confident that we have what you need to support you in having a healthy baby, and also supporting your partner, significant other, family member. Because yes, they may have said, yes, I'm going to be there to support you, but they may not necessarily know how and what. And so Mr. Reeves is here to rally around the fathers, to support them shoulder to shoulder, mentor them, counsel them, and give them the tools necessary to show up for you during your pregnancy journey. All right, so thank you so much, sis. Let's stay connected. Again, we're at 310 South Scott Street in Bainbridge, Georgia. Our number, website, and email is here for you. Go ahead and use that information, and we look forward to supporting you and your family. Take care.